Should I get a risk assessment before lung cancer surgery? Deciding to have lung cancer surgery is a big step, and knowing if you're a good candidate is crucial. A risk assessment helps your medical team understand how well your body can handle the procedure. It's like a health checkup that looks at your lungs, heart, and overall strength to make sure surgery is safe for you. This process is important because lung surgeries, like removing part of the lung or even an entire lung, can affect breathing and heart function. If your lungs are already weak or your heart isn't in the best shape, surgery might carry higher risks. The first part of the assessment involves pulmonary function tests. These tests measure how much air your lungs can hold and how well air flows through them. For example, they look at something called forced expiratory volume in 1 second, or FEV1, which shows how much air you can blow out in 1 second. If your FEV1 is above 1.5 liters, or above 2 liters if a large part of your lung is being removed, and your diffusion capacity is at least 40% of normal, you are generally considered a good candidate for surgery. If these numbers are lower, your doctor might suggest additional tests or different treatment options. Next, your doctor may do a cardiopulmonary exercise test. This test checks how much oxygen your body uses during exercise. If your peak oxygen consumption is above 15 milliliters per kilogram per minute, your risk of complications is lower. If it's at or below this level, there's a higher chance of problems after surgery. Your healthcare team might also use tools like the Thoracic Revised Cardiac Risk Index to estimate your chance of heart-related issues during or after surgery. Assessing your overall health and physical resilience is also important. While there isn't a perfect test for frailty in lung surgery, doctors look at your general strength, ability to recover, and other health factors. The extent of the lung tissue that needs to be removed matters too. Removing a small part of the lung carries less risk than removing an entire lung, which can significantly impact breathing. Sometimes, additional tests like a 6-minute walk test or lung perfusion scans are done to better predict how much lung function you'll have after surgery. All these evaluations together help your medical team decide if surgery is safe for you. They also guide how to plan the procedure to minimize risks and protect your quality of life. Remember, each person is different, and these assessments are tailored to your specific health situation. It's always best to discuss these options with your healthcare team, who can explain your individual risks and help you make the most informed decision. Getting a thorough risk assessment before lung cancer surgery is a key step to ensure your safety and the best possible outcome.